Hi, I'm Dr. Steve Myers, and I'm here with my patient Miley. She's got a complicated history of some right hip issues. She broke her right thigh bone playing basketball at the age of 13, ended up having a metal rod put in to fix her femur fracture. At the age of 20, she had trouble and had a problem called avascular necrosis, where she lost blood flow to the bone in her hip joint and had to go through further surgery to try to bone graft this problem in her hip. And she did fairly well afterwards, but about 2 years ago, her pain symptoms increased again, and she's been having quite a bit of trouble with pain in that right hip. Okay, so before I show you Miley's x-ray, I want to show you a normal hip x-ray so you can better understand how significant the problem is in her hip. So looking at this normal hip x-ray, the blue represents the ball of the hip joint, the yellow is the socket, and the red represents the joint space between the two bones. You want to have nice, thick joint space between the ball and the socket of the hip. So this is Miley's x-ray. The blue represents the scarring in the bone, where the metal rod used to be in her hip joint. The yellow represents significant bone spurs coming off of the ball of the hip joint. The green are some dark cysts in the bone. These are advanced degenerative changes. And then the red, the joint space in her hip is almost completely obliterated. She has hardly any joint space at all. This is essentially bone-on-bone arthritis in her hip. She is now 3 months out from a stem cell injection procedure for her right hip. Okay, so going back to before procedure, describe your hip. What was going on? What kind of pain symptoms were you having? What kind of limitations were you having with your hip in the months before you came to see me?
Major loss range of motion. Had probably about almost a 7 in pain, 6.5, 7 in pain level.
On the 10 pain scale?
On the 10 pain scale. A lot of activity, and I would be down sore for several days. A lot of limping on a daily basis. Sitting was difficult. Sometimes getting in and out of the truck was difficult. Farm work was difficult. Just daily activities being simple, walking around the grocery store. By the end, I was worn out. So.
And what kind of treatments had you had before you came to see me?
After all the surgeries, I've basically only had chiropractic services.
Okay. And what kind of options were you looking at as far as trying to take care of your right hip problem?
The number one option was a hip replacement. I didn't really want to do that, so I had spoken with a pain therapist. I hadn't really gone to see one, but I didn't really want to do that either.
And why ultimately did you decide to go with stem cells?
More research and less invasive.
Okay.
I'm one of those odd ducks that would rather try something out before going under the knife.
Okay. And so here we are 3 months from procedure. How do you think you're doing? How are you feeling?
I feel great. My range of motion's a lot better. My pain level's down to minimal, probably about a 2. My activities are easier. I'm not taking any kind of pain meds very rarely. Only heavy activity or weather changes for arthritis. But
are you back to activities that you couldn't do before?
Well, I'm not running because you won't allow me to run. But yes, I've picked my level back up to my farm work, trying not to lift heavy things just to take care of it. Not lifting as much weights, but I'm still active on a daily basis.
Today, 3 months compared to before procedure, 50%, 70%, 80, 90% better? Put a number on your improvement.
I would say 80 to 90% better.
Fantastic. And at this point, it's still a little bit early on with stem cell, but at this point, do you feel like you made the right decision with your hip?
Absolutely, and I'd do it again. If it prolongs the hip replacement, I'm all on board.
Fantastic. Well, thanks so much for coming in. By the way, I do want to see a couple of motions of you doing some activity. Let's see if we can pick up some of those. Can you go ahead and get it from a chair for me? Pain to do it?
0.
And then can you squat down to the floor for me? Oh, go ahead and step away from the chair. Can you squat down to the floor for me? And back up. Pain to do it?
None.
Fantastic. Well, thanks so much for coming in and showing me how you're doing.
Thank you.